The Nebraska Nurse Practitioners was founded by a small group of nurse practitioners. The organization grew from an interest group in 1979 to a formal organization in 1982, then expanded over the past 40 years to represent over 2,500 nurse practitioners in Nebraska. The purpose of the organization is to promote, develop, and support the role of the nurse practitioner within the state of Nebraska through high standards of clinical practice, professional leadership and representation, legislation affecting healthcare, continuing education, and peer support. Margaret Mead once said, "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it is the only thing that ever has." This describes the Nebraska Nurse Practitioner Organization, and this is our story.
How did nurse practitioners come to be in Nebraska? We have a story. My name is Sister Mary Kay Maher, and I'm a retired family pediatric nurse practitioner.
And my name is Mary Newman, and I'm a retired women's healthcare nurse practitioner.
And I'm Sally Jokins. I'm a retired women's health nurse practitioner.
And I worked as a PNP for 6 wonderful years in San Antonio, Texas. When I had to move to Nebraska, I wanted to contact other nurse practitioners, and I got the name of Mary Newman, who responded to my questions about nurse practitioners in Nebraska. And she said that they were interested in legislation. That wasn't really a big deal or a big surprise to me because I had been involved in some legislation in Texas about expanding the licensure and the role of nurse practitioner in Texas. But when I got here, I found out that I had misunderstood Mary, and I thought we were in the process of better legislation when I found out there was no licensure for nurse practitioners in Nebraska. So I had a professional meltdown. So here I came from Texas to Omaha, Nebraska. Welcome to the good life. No practice for me. But I knew the only option I really wanted was to practice, and therefore I joined these pioneer colleagues of mine and went into working with legislation for licensure as a nurse practitioner in Nebraska. So before we go into the history of nurse practitioners in Nebraska, I would just like to put this in focus of the bigger picture of nursing. From Florence Nightingale days, nurse leaders always had vision, courage, and awareness of healthcare needs that could be provided in the role of nursing. Goals focused on educational preparation, professionalism, legal status, public recognition, and a future-oriented development. From the beginning, nursing faced pushback in different arenas, often from other groups such as medicine, legislation, and at times even nursing itself. So part of this history is history repeats itself. Having provided care for the injured during the Crimean War, Florence Nightingale wanted other women to learn care of the sick. Her vision included educational preparation rather than on-the-job training, which led to the formation of certified nursing programs in England. In the United States, we took on this model. In the 1800s, doctors had been providing services for people in their homes, but were moving care into hospitals, which offered more comprehensive and improved services. Nursing quickly became a necessity in the new system of hospital care, and nursing education was locked into hospital-based training, often with physicians as teachers, and all nursing care and practice was always under and at the direction of the physician. Within nursing leadership, there was the vision of upgrading professionalism through improved educational programs. Nursing education began moving from the hospital-based certificate or diploma program into higher education in colleges and universities. Working in hospitals, nurses were keenly aware that lack of health care in the community commonly led to hospitalization as the only source of care. In addition, there was a shortage of physicians in primary health care, and primary health care physicians' orientation was an illness-based model rather than a preventative model. This raised the question of nurses working outside of hospitals. The idea of expanding the nursing role by delivery of outpatient care was seen as possible, important, and a way to meet this need. In the mid-1960s, at the University of Colorado Medical Center, a nurse, Loretta Ford, and her partner, a pediatrician, Henry Silver, observed the strong, skilled nurses in the hospital care and jointly implemented the first pediatric nurse practitioner educational program. The PNP model recognized and built on nurses' expertise in patient care, but included further clinical education and practice. The model also factored in the nurses' skills needed to provide outpatient care that met patients' social, psychological, environmental, and economic situations. Initially established as a certificate program, it became a master's degree program in the early 1980s, and then later a model for the nurse practitioner programs in the 90s by moving it into the doctoral program. In concluding this brief history, nurse practitioners are an impressive chapter in nursing history. Nurses who moved with response to healthcare needs, vision, knowledge, passion, stamina, and wisdom to assess what was and what could be done. Amidst pushback, but determined to meet the goals of practice, history repeats itself. So now I pass this section of our history on to Mary.
I worked in various specialties for periods of time, ending up in a clinical specialist job at the Planned Parenthood of Omaha. I was there for 3 years, and during that time, we had a relationship or contract with the University of Nebraska Medical Center, their OBGYN department, to provide clinical experience to the residents that were in their OB program. The group formed about 10 people that came to the first meeting, and we, through various contacts, determined that there were maybe 20 nurses practicing in Omaha and Lincoln and 3 in Greater Nebraska. These nurses were practicing trained as nurse practitioners, practicing in roles that were supervised by physicians. There were several challenges that we faced when we started doing this. One was our lack of knowledge about the process. A big problem was the physician's assistants were already well indoctrinated into Nebraska, and they were being trained at the med center. And many physicians felt that they were serving whatever need we might be able to bring, so our role wasn't really adding much. At the same time, the state of Missouri had a law that they had filed against nurses practicing as nurse practitioners, so that was a distraction. As I mentioned earlier, the lack of nurse practitioner education, and then general things like knowing the legislative process, how to work with the State Board of Nursing, the State Board of Medicine, the State Board of Health. Approaching the Health and Human Services informally, several of us discovered that they thought the role sounded useful and worthwhile, but they felt that they asked us what we wanted to gain, and we said, well, we wanted licensure, but we didn't really know specifics of it. So they directed us back to the Board of Nursing and the State Health Department. There was a committee formed by the chairman of the Health and Human Services Committee from the legislature to look at the possibility of licensure for CRNAs who had been working, as I said, for many years without their own separate license. This committee was appointed by the Health and Human Services chair, as I mentioned, but was comprised of his assistant and then representatives from nursing and medicine, their respective boards and associations. They had their first meeting, and a core of us were invited to attend the meeting, but we were instructed to sit along the wall and not speak. The core, and that's a true statement that was said to us. In 1982, the CRNA bill was passed and they became licensed. The committee met again to look at the nurse practitioner role. Now, during all of these hearings that we attended with the Board of Nursing and the Health Department and the legislature, we were told, I was told when I testified at one hearing by someone from the Board of Nursing that we were practicing medicine and they could not help us. After one of the committee meetings, a physician said to me that over my dead body, will there be nurse practitioners? So you can see the challenge that we had. I had never read a bill. I didn't know anything about the process. But being frustrated, I got a copy of the nurse anesthetist bill to see what we should be trying to do. And I modified it for nurse practitioners. I then took it to Sheila Shashula, who was Assistant Dean of Nursing at Creighton at the time, and also on this committee, and had been a supporter for us. And I asked her if she would look at it and see if that would possibly be something the committee would accept. She presented it to the committee, and they approved it, much to my shock.
Delight.
Pardon?
Delight.
Delight, but I was stunned. I mean, I knew nothing. In 1982, the work with the bill drafter began. This took over 2 years. It had to go through a lot of different processes, different committee hearings, and we spent a lot of time on the phone. I was the main contact person because you could only have one person that could be called. I drove to Lincoln many times. I was on the phone with the lobbyists from the Hospital Association, from the Medical Association, and one might wonder why the Hospital Association would be interested. Well, they were two very big lobbyists. At that time, they were primary lobbyists that I knew of that worked with the legislature, and they all seemed to think they had a vested interest. So after being on the phone with them quite a while, it became clear that we were not going to get a bill passed without making an amendment and having a practice agreement attached to it, which we decided to do. And in 1984, the bill passed with no dissent and became law. Then the work really started.
A door cracked open here in Nebraska with legalization and recognition of nurse practitioners who can and will walk through that door. I had been raised on a farm in northeastern Nebraska and encouraged to go into nursing rather than the other options. But then a move from Lincoln to Omaha took me into office nursing. As a family practice nurse, office nurse, I was encouraged to become a physician's assistant, but started a family instead. The ability to provide that care in an extended role became limited due to the lack of legislation and also that Missouri lawsuit. Mary Newman told me about the interest group. When I joined that interest group, I met a master's prepared nurse practitioner, Sister Mary Kay. As we worked to legalize nurse practitioners in Nebraska, I knew full well that any legislation was going to require me to get further education. I completed all the requirements necessary to become a licensed, certified, advanced, registered nurse practitioner. What were the requirements? You had to have your Nebraska RN license. Even though the education, continuing ed, and work history for NP counted toward your RN license, you still had to pay a separate fee, and then the fee for the advanced registered nurse license. I had to pass a national certifying exam. I took the Women's Health Nurse Practitioner exam through NACOG, which was transitioning into the NCC. And you had to maintain that certification through retesting or work continuing education. You have to have an often cumbersome signed practice agreement and follow practice protocols. Practice protocols at that time needed to have the cookbook approach and were supposedly reviewed on a yearly basis. and you had to have proof of liability insurance coverage. So the successes of the first legislation began with the recognition and legalization of nurse practitioners in Nebraska, which allowed nurse practitioners already in Nebraska and those moving into the state to pursue licensure and employment in their advanced practice role. UNMC and Creighton Colleges of Nursing then began to develop an advanced practice programs that were accessible to nurses throughout Nebraska. And the doors opened for NPs to show their worth and to their patients and to their communities. After passage of the first legislation, the NP interest group formally organized into Nebraska Nurse Practitioners. The pioneers stay involved as much as possible. Some became officers in the group, but many were also doing committee participation, conference organizers, lobbying those senators even more, legislative committee presenters, fundraisers, thought provokers. In one manner or another, we help prepare for the next round of legislation to address the barriers to our practice, such as the practice agreement, prescriptive authority, financial reimbursement, and national title licensure consistency. We would like to acknowledge the other pioneers that worked diligently along the way, including, but not limited to, Georgie Evans, Carla Domgard, Loretta Munger, Diane Lesh, Karen Knapp, Barb Morton, Debbie Conley, and Jane Pearson. We apologize if our pioneer minds have failed to remember the correct spelling and or names of others. Mary Kay, back to you.
Well, we told you we had a story, and this is our story, which in the bigger context of nursing is nursing's story, and that is history repeats itself. So this is our story, and we hand it off to you for future stories. Thank you very much for the opportunity to present the history of NPs in Nebraska.
I came to Omaha to become Dean of the College of Nursing at the Medical Center. And I had been here a few years when the practitioner programs began opening. But we had none in the state, and I tried hard to recruit because the Associate Dean for Graduate Programs wrote a grant, and we needed a director. She wanted to start a nurse practitioner program in Kearney, a family nurse practitioner to help in rural areas, which made a lot of sense, and it was funded. It was just too difficult to recruit nurse practitioners who had qualifications to do teaching. And so I finally decided and asked the graduate dean if I could prepare some of our own faculty as nurse practitioners. And I asked the faculty about it, if they would be willing to take the courses, but I had to bring in outside faculty from schools all around to at least evaluate them and to do some of the teaching, because of course they could make much more money as a nurse practitioner than they could on faculty. And but I decided that that would be helpful. If they could get jobs, it would probably help our graduates then to get jobs after we set up the program. So we got all the faculty educated for teaching in NP programs. A few had gone other places and had gotten specializations and had preparation. But we then, that was about the time I was retiring, but once all of the faculty were prepared, we started the programs, and that really was on the new dean's watch. She came in after I was leaving, and I was leaving at the time that, I didn't leave the college, but I was leaving the deanship at the time that all the faculty were prepared. But they went ahead and set up the programs then. And so we were able to start nurse practitioner programs in the state, and we're the ones who started them, the UNMC College of Nursing. In fact, my granddaughter even got her doctorate as a nurse practitioner. And so she went through the program that I helped to get established.
Well, when Rosalie Yeworth recruited me from Sault Ste. Marie, Michigan, and I remember my husband Roger and I sitting there opening a map because she wanted me to move to Kearney. And we were going, where is Kearney, Nebraska? And she called 3 times before she finally got me to show up. And so she was very, because I was very hesitant. But when I got here, the grant was just really a fairly traditional family nurse practitioner program. There had never been anything like it in Nebraska, and this was in '93. It was based in Kearney, and that was the reason that she wanted me to go to Kearney. The whole sell, if you will, on the grant was we're doing this program in Kearney to train people in rural Nebraska. So I really did have a vision for it that was about being in, out of rural Nebraska, but touching all parts of Nebraska. And it really, in some ways, what I considered my way it should be, a vision, came to fruition because we had that cohort in Kearney, so we always had somebody in Kearney, but we went out and had a cohort in Scottsbluff so that people didn't have to travel so far. And then we had a cohort in Omaha, and the next thing you know, we had a cohort in Lincoln, and then a cohort in Norfolk. So we were bringing people in, and it was, at the time there were 53 nurse practitioners, as I recall, in the state of Nebraska. And so the vision was to get nurse practitioners in the state of Nebraska. And we had the physician assistant program was very strong. It had been in place for a long time. The role was well established. And so we had to go out and say, we're different, we bring something else to the table, and please consider us. And that's what we did. I truly, truly believe that the future of family nurse practitioners is to be the primary care provider of choice in this country. There's new data from in the last 5 years, I guess. The numbers are going down. PAs, the numbers going down the same way, and nurse practitioners are going up. And I just believe that we should be the provider of choice for primary care in the future of this country. We can do 80% of what a physician can do. So we have physician partners. We refer. That's what primary care physicians do for specialists. Anyhow, and I think we bring to the table a set of skills. I think we always have. People ask me about how the scope of practice has changed. I said it hasn't changed. It hasn't changed at all. We do primary care across the lifespan, and here's what primary care is. Health promotion, disease prevention, risk management, acute minor illnesses, stable chronic illnesses. It's never changed. And but what we are now is independent and able to do it ourselves. And that's what I think is the future. We have to go hang up our shingles, frankly, and compete. And that's my vision for the future. I became the director of the FNP program in '94, I think, and was in that position until I left Nebraska that time in 2007. And we kept a very traditional education program that I thought was very effective. I mean, we did distance learning. First of all, we went to Kearney, and then we moved to Omaha, and we had this poor man, Don, who had to sit in this little room off of our classroom and literally televise us and send us on the television across the state. And so I'd have these little images of the people. And of course, then I remember when we got online and started doing, we'd have to, when we recruit students, we'd say, do you have high school students in your family that can help you with this? Because, they didn't know how to be online. We really had very traditional courses. We had a health promotion disease prevention course across the lifespan. We had an acute minor illness pediatric course, and we had a chronic illness adult course, and then we had a synthesis course. And we did a lot of lecturing, which is really looked down on now. But, what I used to do, and what my colleague Polly Hume, and I want to acknowledge Polly. Polly was my partner in this for years, and I think we did a good job. We had, we knew how to synthesize the content in a way that went from risk and evaluation to management and outcomes in a way that told stories and involved active listening, even though it was a quote-unquote lecture. And then what we would do is bring the students together, and you remember this, Steph, because you were our faculty in Kearney at the time. We'd bring them together once a month, and we would do what would today be called problem-based learning, and we would say, okay, so-and-so presents with X. And we would talk through for several hours what are the differentials? Because patients aren't their diagnosis. Patients are their whole. And nurse practitioners see that. And so we need to make sure that we keep that in education and that we facilitate that. The next thing is we move into DNP, which I'm very comfortable with. But I find that working with DNP students and graduates, that they're still focused on that practice piece, and they really struggle to push themselves up into the system things. And yet, when you really want to make change, or when you want to really impact the healthcare system, we need to own the system too. And that's going to be a challenge because they are moving. I mean, they're learning to diagnose and treat and prescribe, and that's hard. And then to ask them at the same time to learn how to make changes in the system is a challenge. But they'll do it. They can do it. I was blessed with early on making a decision to become a nurse. I learned in nursing school to love primary care, and I was blessed with the nurse practitioner role and making that decision early. And what a life it has been. And so anybody who's questioning what they want to do, it is great to be a nurse. It is great to be a nurse practitioner. It's great. I love, even today, and I don't practice much, but I walk out of a room working with a patient and I'm wired, still wired 45 years later. And so it's a blessing and a gift. And I hope that everybody hearing this will be blessed with the same sense of enrichment from this life choice.
In 1992, there were 9 students accepted into the University of Nebraska Med Center's first NP program, and it was also the first here in the state of Nebraska. Dr. Pat Lindley, Dr. Kate Fyant, and Diane Lesh were some of the first instructors in the program. They believed that it was vital that we be involved in our professional organization and made that part of our curriculum. So one of our, as a student, one of our requirements was that we immerse ourselves in our professional nursing organizations. That included national organizations such as the American Nurses Association, the American Academy of Nurse Practitioners, and state organizations like Nebraska Nurses Association and the Nebraska Nurse Practitioners. One of my first memories of the Nebraska Nurse Practitioner Organization was at a meeting. There was a small group of nurse practitioners. They were very well informed. They were passionate and committed to the cause of promoting the nurse practitioner role here in Nebraska. And they were absolutely thrilled that there was a new program here in Nebraska that would be providing students that would become members of their organization. They were committed to bringing change through the legislative process, and they encouraged all of us to become involved in that process. At the first meeting that I attended, I was surprised to find that there was very little monetary support of the organization, and so they would ask for donations at the end of the meeting. So of course everybody would either write a check, lay a dollar bill, $10 bill, $20 bill on the table, but then they always wanted us to empty the change out of our purses. And so that's what we did. We piled it on the table and then we counted it. This was one of the ways that we paid for our legislative fees and were able to support our organization. Carla Damgard was one of the members of the Nebraska Nurse Practitioners, and she was in charge of fundraising. So she came up with an idea that thought that maybe we could raise some money selling t-shirts and sweatshirts. And so she ordered hundreds of t-shirts and sweatshirts. But we didn't think that people in the communities or across Nebraska would buy them if they just had Nebraska Nurse Practitioners on them. So we thought that it would be a great idea if we honored all nurses, and we called it Nurses in Your Neighborhood. And so we thought of all the roles of the nurses in your neighborhood, and we put them on the shirt. And so she challenged all of us to take many of those shirts back home, sell them in our communities, and we would raise money for Nebraska Nurse Practitioners. The original members of our interest group were always role models for us as new members. They were thrilled that we were willing to put our time and effort into the organization, and they encouraged us to be leaders within the organization. There were very few members during that time, and so all of us felt compelled to step forward and offer our service and our leadership to the organization. The pioneer leaders were not just our role models, they became our dear friends, and they were people that we could count on for advice. They had been through a lot in the process of advancing legislation throughout in the state, and they had lots of wisdom, and they were willing to share that. They were also willing to listen to our frustrations when we were experiencing barriers to practice, and they helped us come up with ideas how to challenge those barriers and to overcome those barriers. I was one of the first nurse practitioners in a rural setting, and as you can imagine, there weren't very many nurse practitioners in the state, so I was fairly well isolated, and I felt that way most of the time. So the only time I got to see my nurse practitioner colleagues and classmates was when I attended Nebraska Nurse Practitioner meetings or their educational offerings. So this was always a great time to network and share. We always look forward to it and look forward to meeting at our annual conference and share things that had been going on in our practice and share some of our trials and tribulations as well. When I graduated in 1994, nurse practitioners were required to have a collaborating physician, as well as practice protocols. And actually, we didn't really know exactly what practice protocols were, but the idea was that we would have it documented, the protocol that we would use to see a patient. If we were diagnosing them, what would we do? What was the process? And those had to be documented and sent to the state. Well, Nebraska Nurse Practitioners was instrumental in helping to remove that barrier and helping us to get rid of those practice protocols. But when we were using those practice protocols, physicians would refer to us as using cookbook medicine. And when I look back at those books that were full of those processes that we were supposed to utilize, all of that was based on evidence-based practice. And today, we utilize those as standards of care. So it's funny how we went from calling it cookbook medicine to now it is an actual standards of care. We had limited prescriptive authority at that time, and it was hard because many of us were out in rural clinics and many times not near our physician collaborators. So, for example, when I was taking care of hospice patients, I could only write a prescription for their pain medication for 72 hours. 72 hours is only 3 days. And so our hospice patients would then need a new prescription every 3 days. It is vital that we as nurse practitioners become active members of our organization, because this is the only way that we've ever instituted any type of change in our organization, change in legislation. NNP members were a wealth of information. They were always available whenever we had questions. Maybe it was legal question, maybe it was an insurance question, maybe it was a clinical practice question. They were always available. They also were available to provide a shoulder to cry on when we were frustrated and didn't know what we were going to do next. So the NNP provided huge support to all of the new students and continue to provide that support for each other as colleagues and friends. Not only does NNP focus on the legislative aspects that are needed to break down the barriers to practice, they also focus on providing high-quality education, and we've done that for over 30 years. There are many moments, as I look back on the history of NNP, that I am most proud of. I think our legislative efforts that resulted in full practice authority has to be at the top of the list. Our educational offerings that we provide are top-notch, and we get many compliments each year about the high quality of the education that we provide. And those educational offerings are also providing the CEUs that nurse practitioners need to relicense and recertify. I think the most important thing that I want to convey is the importance of being involved in your professional nurse practitioner organization. It is vital that every nurse practitioner understand how important NNP is to how they practice today. Our founders laid the foundation, but there were many hoops to jump through, lots of mountains to climb, and most importantly, hours of work behind the scenes, so that finally Nebraska nurse practitioners would have full practice authority. If it weren't for the hard work and dedication of the NNP members, especially those in leadership roles and those in the legislative committee, there would be a completely different story told today.
Happy 40th anniversary, Nebraska nurse practitioners. I am Brenda Bergman Evans. I am a registered nurse and have been for 53 years. I also am a nurse practitioner and have been for 25 years and served on the APRN board for 14 years, 9 of those as chair. I am joined by Linda Lejeune, who was very prominent in the passing of the legislation LB 414 in 1996. She was then serving as the president of the Nebraska Nurses Association.
Thank you. And I was the Nebraska Nurses Association president, and it's ironic that I was there for the birthing of the integrated practice agreement and the board, and I was also there from 2014 in an effort to get rid of the integrated practice agreement. So it was an honor to serve as the Nebraska Nurses Association president with the Nebraska nurse practitioners as partners in our coalition. And then went on to be on the Board of Health and then the Board of Nursing, as well as chair of the Board of Health eventually.
We'll talk some about the APRN board and education of NP students, but I think more importantly, we'll talk about the real value of relationships, nurturing relationships, maintaining relationships, both with our nursing colleagues and also with other health professionals.
Well, yes, and I remember one thing that just really strikes me is when we were first starting this, we had a couple of senators, and one senator had breast cancer and she had to pass it on to another senator. Ann Ortwick was my partner in crime. She was the executive director of the Nebraska Nurses Association, and I distinctly remember going to the family practice convention, and the fellow who was the head of the family practice at that time said there were less than 100 nurse practitioners in the state, and everybody clapped. And I thought, okay, we've got a big job to do. And we were there. We thought we were being very friendly, and we were there trying to build relationships, which I really believe in. We didn't act like we were insulted. We just said, okay, this is what we have to deal with. And they were very proud of the fact that there were less than 100 nurse practitioners in the state.
Well, I have been asked to speak briefly about the APRN board and as an educator of NP students. Nebraska is a unique state, having the only unicameral and the only APRN board in the nation. Thanks to the late Charlene Kelly, the APRN board has the honor of holding its full membership in the National Council of State Boards of Nursing with both a voice and a vote. Its purpose is to protect the public by administering and enforcing the APRN Licensure Act to provide for citizen health, safety, and welfare. So did the purpose of the board help us guide the work. Debates were often lively as myths and misconceptions, especially about waivers and the value of practice agreements, were discussed over and over again. Fortunately, as we worked through Tuckman's forming, storming, norming, performing stages, we were able to learn from each other and find common ground. Respecting, hearing, and valuing each board member's voice and not allowing any voice to dominate. Eventually, we were able to find consensus, never reaching a figurative junior high dance moment when the boys were on one side and the girls were on the other. A couple of specifics worth mentioning about the board work. People will forgive you for making a mistake, but not for lying. One needs to tell the truth, no matter how hard. There is only one name on your nursing and advanced practice license. So it is up to the named individual to know the statutes and scope of practice. Although community standards and job descriptions are important, scope is ultimately based on license, certification, education, and training. Workplaces can narrow the defined scope, but they can't expand it. And the final comment on the work of the APRN board, each of the 9 positions needs to be filled by individuals who respect and are interested in promoting the purpose. Our job now is to find them and encourage them to serve when the position opens.
Well, I can provide you with how this board came to be, but I want to go back a little bit to the first legislation in the 90s. I believe it was 414 was the bill. And at that time, as you said, I was president of the Nebraska Nurses Association, and it was like winter break. I was teaching at Creighton, obviously, and so I had some time in winter break. Well, all the physicians were going to go to the Nebraska football game. And so I said, well, I'll meet any time. So Ann and I got a negotiator. We paid, the Nebraska Nurses Association paid for a negotiator. And so it was Ann Ortwick and I, and then 2 physicians. A day or 2 before, I had had someone from the State Board of Nursing do a word search. Well, back then, word searches weren't quite as easy as they are now. But she did a word search, and I said, please search for the word health, because I suspect that it's not in there. The word health, interestingly enough, never appeared. And so I just put that in my back pocket as we went into the room to negotiate. And the physicians were in a hurry because they were going to go to the football game. You know, they had to travel to the football game. In the midst of our discussions, I drew a Venn diagram, and I drew a big circle on the board, and I said, this is health. And I said, and then I had another smaller circle, and I said, this is nursing. And then I had a smaller circle, and I said, this is medicine. And I said, for one, we nurses are really involved in health, so that's why we would have a kind of a broader scope. And I said, and did you know that we, the nurses, don't need your permission for everything we do? Only about 1/3 of what we do is with your permission or your orders. And I said, I prefer not to say orders because I think words are really powerful. And I said, I think you should call them prescriptions, because that's what what they are. But they took a bit of offense, and I was very friendly about it. I said, physicians are very focused on diagnosing and treating a particular thing, but nurses and nurse practitioners would take into account the family, the environment the person is in, not only their physical health, but their spiritual health, their mental health. And so that would justify having a larger circle in that Venn diagram and a larger circle within health. I don't know if they agreed with me at the time, but I really wanted to state that nurses don't necessarily need a physician's permission to do much of anything. Many of the things that nurses do, in fact, most of the things that nurses do, you don't need permission.
And we think about how the social determinants of health now have become so prominent in thinking about how people heal. You were really ahead of the time.
Well, all those things weren't really talked about much then. There was another time, when you get to making the sausage of legislation is not pretty. And we were fortunate that we had lobbyists to help us. And at the time, Don Wesley was a senator in the unicameral, and along with Ron Witham. One of the most important features of a bill are the definitions. And the definitions are what you live and die by. And it doesn't have to be Webster's dictionary. And so when we first started out, we were very specific about what supervision was, because that was a big deal. And so Witham and Wesley devised a vote that had to be done about having a broader definition of supervision and a little more circumscribed definition of supervision. And I can't remember all the details, but the vote came that we had to, cut down a little bit for what we wanted to do. But supervision was still how we defined it in the bill. And so when people discuss supervision or any kind of word that's in a bill, they have to go back to the definitions, and they have to use those definitions, not what you think it is, but what is in the legislation, because the regulations are going to come out of the legislation. They can't go further than the statute, but the regulations then are just as binding as the statute. In fact, they get down into the nitty-gritty. So you not only have a chance when the bill is going through the legislature to get your input in, but you have a great opportunity once the regulations get put in. And people forget about that many times, because that's really important. Well, I've got more stories. We always hear about the room where it happens. And so one of the things that was kind of a sticking point with the first legislation was, how the heck did we get a board anyway? And how the heck did we get an integrated practice agreement? And I can tell you, I was in the room where it happened. Fast forward to 2014, and I actually gave testimony on the bill. It was now 916. And I said, I can assure you that the 1996 insertion of the IPA, the Integrated Practice Agreement, into LB 414, the original statute, was not predicated on evidence-based practice, nor was it a validated factor to assure safe care to Nebraska citizens. The IPA was an expedient political compromise. I did think at the time, however, that the IPA would open the long closed door to collaborative practice by providing a mere affidavit to the nurse practitioner that could identify at least one physician colleague for, quote, consultation, collaboration, and referral. And so that's how it happened. It was at a meeting, again, with the nurse practitioners, the Nebraska Nurse Association, Ann Ortwick and I, meeting with the lobbyists, with the Medical Association and Family Practice. And at the time, I thought the separate board was a bill buster. I thought, oh, we've been trapped. And I was really, really kind of scared at that time. You don't want to show that you're scared, of course, but I thought, and I said to Ann, I said, oh, I don't know if this is going to work. And so we worked through it that day, and I thought, okay, we're going to go with it. Ron Witham became the speaker. Yeah. And it was like, oh, this is nice, because he was always friendly to our cause. And the speaker gets to identify the scheduling and when bills come up. And so Ann and I, and the nurse practitioner was there, we were in his office, and the physicians were late. And this kind of made Witham irritated. And he said, well, I'm the one that does the schedule, and I'm going to put it on the agenda. I did always wear my windmill, and I always have worn this all through all the things, because I thought the windmill is a Nebraska symbol. It symbolizes quiet strength, power, and it can get a lot done. Yeah. And so I always wore it, and it was my talisman as we went through these things, and it helped.
I think one thing I hear you saying a lot and over the years was the importance of never burning bridges, because you just never know about it.
Well, remember that day when I said there was the hospital association lobbying with the medical association, and I just thought, oh, the wind just came out of me. But later on, we were able to still do the negotiation. We would always negotiate back and forth and stuff. And so when we agreed on the integrated practice agreement and the board, and we finally got some headway with that, then the last reading, I distinctly remember being in the rotunda, behind those glass walls. And so I'm talking to some of the senators, and I had the hospital association person right next to me. And the senator says, are you guys agreeing on this stuff? And I said, yes, today we are all in tune. We're all on the same page. We are doing this. And it was interesting, because the senators were kind of shocked. And it did pass. And at the end of it, I was always amused, because it was Governor Nelson at the time said, this was one of the smoothest the things he had ever done. And it was like, oh, well, you don't know. But I invited the hospital association and the medical associations. And so it was important to turn around and to close that loop and to be friends. And it was really important to not burn bridges. Yeah. And to be strategic about it. And then it was really great, because after that was signed, I went with the medical association, couldn't be there that day, but we went to the governor's mansion, and I was with, he was the administrator at the Children's Hospital until he retired recently, but I went with him to the governor's mansion, and we really talked about different things, how we could manage health, how we could do some healthy types of things in Nebraska together. And so really, I don't think a lot of people know that, but that's a great thing to be able to do, and to really work together. And as Nebraska Nurses Association president, even before we did the legislation, Ann and I would invite him to we were on South Street, I believe, at the time, and we would invite him to lunch like every month or two, and to really just talk about things, because we weren't into the nurse practitioner stuff yet, but we were laying the groundwork for it. And we really want him to know who we were and the relationships that were there. We tried to really build solid relationships, and I think that's really key to this. You've got to think ahead. You can't be caught off guard and just kind of make it up as you go along.
One of the things also that you've talked a lot about is the importance of nursing, and I think the importance of nursing as the part of the advanced practice registered nurse title. And so another thing that I had thought about that will help with uncertainty is really clarity of who we are and what we do. NPs need to be able to tell who they are, what they do, and why they are qualified to do it before people's eyes glaze over or they interrupt them. And that's about 30 seconds. Most importantly, it needs to be done without referencing any other professional or colleague. It needs to be positive, persuasive, and tailored to what is needed for the current situation. One does need to be able to answer, though, what is the difference between a nurse practitioner, a PA, and a physician, if asked. But in my experience, people seldom ask. And patients want a caring and competent professional, period.
It's so disheartening to see many times nurses are the ones that kind of stab you in the back. And I think I told you about I told the nurses one time, I said, I will go, I'll be out in that limb for you. Don't worry about it. I'll be out in the limb, but I better not, darn well not see a nurse sawing off the limb that I'm on.
Right. And I think that never has there been a time when people working to the top of their license is more important than it is now. And we really need to be preparing students that can tell who they are, who they aren't, but mainly who they are, so that the public and also employers know. Because once again, is that you have to stay within your scope of practice, no matter what. Another thing that you brought out is the importance of stories, because I think that is taking it from the theory to the practice is really important.
Authentic voices. Authentic voices really have carried the day. I remember when early on, Mary Kay Maher was working down at One World, and she came to a very key hearing. Dr. Peets came that day, and he was a physician, and he really turned the tide because he was a former president of the NMA, and that really pulled folks to our side. But Mary Kay was there, and she had a Hispanic lady and her child there. And so we were in the Health and Human Services hearing room. And so the senators were being very friendly and very, solicitous to her and the child. But Mary Kay, with this patient there, and the child could tell a story that they could not only hear, but they could see. And it was just profound. And I really thought that turned the tide. Between Mary Kay and Dr. Peets being there, that turned that tide. And then we eventually got together, and we were able to, all three organizations, all four organizations, Nurse Practitioners, Nursing Association, Medical Association, Hospital Association, could go in as a united force and be there at the signing, which was just phenomenal. And I was, like I said, I was worried about the board, but in your position, and I was so glad you were on it, because there were some physicians that really wanted to be on it to scuttle the whole thing. And so it took some great leadership to get that board rolling, what each stage is going, because that's what they have to do. And same way with the regulations. Just because you got the bill passed doesn't mean everything's over. The regulations sometimes is where mischief can be done, but sometimes great things can be done. And I know after all of this, I was appointed to the Board of Health, which was marvelous because I got to help approve the regulations for that bill. And so it was wonderful. But every time I was looking at another health-related bill, I could say, well, what about the nurse practitioners? For example, there was a law about who would do physical exams on child care center children. And it was just listed as a physician. And I would always say, and they got tired of me saying this, but I would say, well, the nurse practitioner could do that as well. So then they had to go back in and add the nurse practitioner. But again, it points out if you're not in the room where it happens, you're not in the room. And we've always said, you know what I'm going to say. We've always said, if you're not at the table, you're on the menu. And is that ever true? Yeah. If you're not, and you earn a place at the table, it doesn't come to you. You have to earn it.
Yes, I think another part of that is really thinking into the future when language is put into statutes, because I think of how much challenge it has been to change the languages that physicians or doctors do things. And the reason it was put in there originally is that's the only people that did it. And so how can we make sure that the language is neutral enough that it can be changed in the future without without a lot of argument.
Yeah, or it can be interpreted, yeah.
Well, and I think going back again to really the value of nurse practitioners embracing being nurses, because physicians may have fussed, and they have fussed about nurse practitioners, but they've always trusted nurses. And I think that we really need to make sure that nurse practitioners are running towards being a nurse rather than running away from being a nurse. I have just a couple of other things. There's one of them as far as helping nurse practitioners, students, and new nurse practitioners to be comfortable with uncertainty is we really need to encourage them to be kind, especially to themselves, and to be proud of their nursing background. I think that's come out over and over again. Experience as a nurse is often our salvation when our nerves are frayed and we are afraid. So Loretta Ford, the 100-year pioneer that started the NP movement, penned the article entitled "Fasten Your Seatbelts. It's going to be a bumpy ride." She talked about well-familiar themes that the Nebraska nurse practitioners have dealt with: the needs of setting expectations, being flexible, and challenging opposition to change. She used two quotes that seem fitting for our 40th year celebration. One Tibetan proverb, "It is better to live one day as a tiger than 100 years as a sheep." The other from Joan Rivers, "Life is a movie, you are the star, give it a happy ending." I will add the African proverb, "If you want to go fast, go alone. But if you want to go far, go together." The successes of the NPs in Nebraska have certainly benefited from the journey together with both nurse practitioners and with our nurse colleagues. Congratulations on the anniversary and journey. We have come far together, but there is still work to be done.
I got started with legislative work for nurse practitioners in Nebraska in 2013. And I had heard about the 407 process to present all the facts that substantiate full practice authority for nurse practitioners. In 2012, a group of dedicated nurse practitioners from Nebraska started a 407 review with the Health and Human Services Committee at the unicameral. This is a very in-depth process where all the facts, the legal facts, the research that would back up the safety of nurse practitioners having full practice authority. In late 2013, it was voted on by the committee, and they had approved that we could go forward with a bill for the unicameral. This was sponsored by Senator Sue Crawford and was introduced in the 2014 legislative session. We went through it. It went really well. And on the very last day of session, the then governor vetoed our bill. And the next day, we could not have further work to continue the work for that. So we had to regroup, get another bill written. Senator Sue Crawford was again our sponsor, and it was like a silver lining that it had been vetoed, because that year, every office that I went to at the Capitol building, they said, "Oh, we remember that. That was really underhanded. He should never have done that." And what happened was it made the 2015 legislative session go so well that it passed like in 5 minutes of vote. And we were all just kind of stunned, and it was almost unanimous. So in 2015, Nebraska nurse practitioners won full practice authority. We were the 22nd state in the United States to do so. And we were really, really proud and thrilled, and knew that it was important for us to continue to protect that full practice authority so that we would never have the chance of having somebody fight against it. And to this day, we still very closely guard full practice authority. It made me very proud. In 2014, I was co-chair
of the Legislative Committee. And then since 2015, I've been the chair of the Legislative Committee for Nebraska Nurse Practitioners. Barriers to practice are still out there, and we're still trying to explain and get those removed when many times they're just total nonsensical. They don't make sense, and they're there because they've always been there. So we continue to work on that. Another thing that I was very proud of was working with AANP, our national organization, and going up to Washington, D.C. for the Health Policy Conference for many years, and talking about getting nurse practitioners the authority to order home health care for their own patients. At that time, even if you had full practice authority, even if you saw your own patients, you would have to have a physician who might not even know your patient write the orders for home health. One of the things that was a very big silver lining, if you can, of the COVID pandemic was that the CARES Act distinctly recognized that nurse practitioners and PAs can write their own home health orders. And one of the barriers to practice here in Nebraska when that became evident was that Nebraska Medicaid has not let nurse practitioners or PAs write for durable medical equipment. That's wound care supplies and oxygen supplies and nebulizers and walkers. And before that time, Nebraska Medicaid would not allow nurse practitioners and PAs to write those. We sent letters to the governor, who sent letters to Nebraska Medicaid, and soon thereafter, they allowed nurse practitioners and PAs to write for durable medical equipment. You can't do home care without that. So those are the little tiny things that aren't so tiny for our patients that we work on every day. We've looked at hospital privileges. We've looked at, obviously, the durable medical equipment. We've had other people bring issues to our attention that have to do with the transition to practice, the TTP agreement for new nurse practitioners, new graduates. We have worked with the Board of Nursing, working on compact licensure, on consensus model, and we maintain that relationship with the Board of Nursing. So we're really encouraging new membership and continued membership in our professional organization in the state so that we can continue to decrease barriers to practice. Other things that we've dealt with is telemedicine, and this was pushed to the fore during the pandemic. We are still in the pandemic, but now insurers are starting to withdraw payment for telemedicine. And even Health and Human Services, Medicare, Medicaid are looking at regrouping around telemedicine, and we hope to be a voice at that table with our national organization and with any voices that we can from Nebraska as well. Barriers to practice can be worked on, how things can be changed, how our profession can be furthered. And without your membership in NNP and without your participation with our professional group, we don't have the power to make any changes.
I think our current model isn't working. We've been educating the future generations on the backs of the current providers, and that's just not fair, and it's not sustainable. So I hope that as a profession, we can come up with a new model and do something different. I think because of the pandemic, it's shown that we can do things differently. I think using more virtual reality or virtual simulation, educating more about telehealth and telemedicine will be good. As far as organizational growth, I want every nurse practitioner to be a member of Nebraska Nurse Practitioners. New graduates and seasoned professionals understand that without their support, we're not able to do what we've been doing, which is to provide legislative efforts and advocacy efforts here in Nebraska and provide continuing education and just be a voice at the table. The proudest moment I've had serving in a leadership role with Nebraska Nurse Practitioners has been the passage of our Full Practice Authority Bill in 2015, We worked really, really hard in 2014 to get it passed, and it was not passed because of a pocket veto. And so we came back even stronger in 2015. We gathered more support. We showed data and evidence that nurse practitioners do provide high quality care, and the legislative body listened. We are a volunteer-run organization, and we've done it for 40 years. And so I am really honored to have been a part of this organization for the past 10 years. It is a little bit mind-boggling that it's been around for 40 years and that we've been fighting for 40 years to get the nurse practitioner role in Nebraska. I am so grateful for all of those that came before me that put their pennies in the bucket and helped get it going. And I hope that I've done them proud by continuing to carry on their legacy and do the things that needed to be done to make sure that this organization continues on for another 40 years. I think it's really important that we have a voice here in Nebraska and that we use that voice to promote our profession and to elevate our communities and to take care of patients. And I'm just really glad that I got to be here and that I got to be a part of this journey.